like to call the House Health Committee to order. Will the clerk please open up the board where the members get logged in and take the roll? Are we there? All right. All right. Will the clerk please take the roll?
Mr. Chairman, you have 15 members present. You have a quorum.
All right. Thank you. And we've got two more coming in here. All right. Before we get started, do any of the members have any personal orders? Yeah. All right. Representative Lynn, you're recognized.
Thank you, Mr. Chairman. We'd like to wish everyone a happy St. Patrick's Day. And Chairman Kumar has truly outdone everybody on the committee.
And we have a doctor of the day, Dr. Reeves Johnson. Is Dr. Reeves Johnson in here? There we go. Thank you. From Gallatin, family medicine doctor. So thank you for joining us and being our doctor of the day. All right. So we have a calendar, and we're going to try to, we may skip around a little bit here, but we have some bills that had been on last week's calendar, so we're going to go with that. So item number one, Senate Joint Resolution 592 by Representative Hicks. Is he? Oh, there you are. Okay, you are recognized.
Thank you, Mr. Chairman. Thank you, members. Senate Joint Resolution 592 designates March 12th, 2026 to be the one to end Suicide Day in Tennessee. This resolution recognizes the American Legion's Be the One initiative, which was launched with a mission to end veteran suicide and encourage Americans to step in when someone is struggling. The statistics behind the effort is sobering. Across our nation, approximately 22 veterans die by suicide every single day, and the challenge goes beyond veterans' community. Suicide is now the second leading cause of death for young people between the ages of 10 and 24, with an estimated 6,500 young lives lost each year. Here in Tennessee, our suicide rate is 14.7% higher than the national average, according to the Tennessee Department of Health. This resolution encourages public and private organizations across all 95 counties to raise awareness, provide suicide prevention training, and promote 988 Suicide and Crisis Hotline so people know help is available when they need it the most. The message behind this initiative is simple but powerful. Be the one who reaches out. Be the one who listens. Be the one who helps save a life. Members, I respectfully ask for your favorable consideration of SGR 592. Thank you, Chairman.
All right, thank you. Do we have any questions for the sponsor? I do have one. Can you give everybody that hotline again?
Yes, sir. That was 988 Suicide.
All right. Thank you, guys. Okay. Seeing no further questions, clerk, can you open the board for the vote? All those in favor vote aye, opposed vote no. All right. Let's see. Has everybody voted? Anybody wish to change their vote? Okay, well, clerk, can you please take the vote?
Mr. Chairman, you have 19 ayes, 0 nays.
All right. Senate Joint Resolution 592 passes and moves on to calendar and rules. All right. Representative Sherrill, you're recognized.
Thank you, Chairman. Just want to welcome our White County Leadership Group. If you would stand, please. Make them welcome, if you would. Thank you.
All right, out of order.
Thank you, Chairman.
All right, thank you. All right, that brings us to item number 2, House Bill 1770. Chairman Martin, you are recognized. You have a motion and a second, and I believe there is an amendment.
Yes, Mr. Chairman, it is 014388.
Okay, 014388. We have a motion and a second. Yeah, we have a motion and a second. Okay, let's go ahead and get that on the bill. All those in favor say aye. Opposed, ayes have it. Amendment passes. We are on the bill as amended. You are recognized.
Thank you, Mr. Chairman and committee. This legislation updates Title 63 to ensure that the practice of medicine in Tennessee keeps pace with how patients actually receive care today, particularly our patients in rural communities and those managing chronic diseases. We're adding 3 new medical professions: a doctor of clinical informatics, a doctor of lifestyle medicine, and a doctor of medical virtualist. Lastly, this bill clearly makes medical necessity determinations the practice of medicine and the purview of the licensing boards. It'll allow the board to assess whether recognized clinical criteria and appropriate standard of care were used in making medical necessity determinations. If not, the physician's license would be subject to disciplinary action by the board. With that, I stand ready for question.
All right, do we have any questions for the sponsor of the bill? Seeing none, will the clerk please open the board for the vote? All those in favor vote aye, those opposed vote no. All righty. Clerk, will you please take the vote?
Mr. Chairman, you have 19 ayes, 0 nays.
House Bill 1770 passes and moves on to calendar rules as amended. Okay, that brings us to item number 3. House Bill 1984 by Chairman Hill. You are recognized. You have a motion and a second.
Thank you, Mr. Chairman. House Bill 1984 allows current prescribers of buprenorphine to administer the prescription directly via injection. And Mr. Chairman, pending any questions, I seek passage.
All right, do we have any questions for the sponsor of the bill? Seeing none, we are going to vote on House Bill 1984. Will the clerk please open the board for the vote? All those in favor vote aye, opposed vote no. Will the clerk please take the vote?
Mr. Chairman, you have 20 ayes, 0 nays.
All right, House Bill 1984 passes and moves on to calendar and rules. All right, that brings us to item number 4. House Bill 2021 by Chairman Martin. You are recognized.
Thank you, Mr. Chairman. I don't believe there's an amendment.
Can I get a motion?
No,
Okay, you have a motion, a second, and there is an
there is.
amendment.
Yes, sir. 013110.
013110. Can I get a motion? You have a motion, a second. If there's no objections, go ahead and get that on the bill. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bills amended.
Thank you, Mr. Chairman and committee. This bill here comes to me from the Podiatry Association. And what we're looking to do is this legislation will allow podiatrists to treat soft tissue up to the tibial tuberosity, which is just below the knee. The amendment that we added on just clarifies that it's only soft tissue up to the tibial tuberosity. And I think Dr. David Long is not here today, but he's traveled at least the last 4 weeks to speak on it. But he has done a lot of work, so I want to thank him on record.
All right. Do we have any questions for the sponsor of the bill? I do want to make a comment on there, and I do want to thank everybody that's worked on this bill to get this bill in that posture. And this is something that's sorely needed. And so, again, thank everybody that did work on this to get this in this posture. So will the clerk please open up the board for a vote? All those in favor of House Bill 2021, vote aye. Opposed, vote no. Will the clerk please take the vote?
Mr. Chairman, you have 19 ayes, 0 nays.
House Bill 2021 passes and moves on to calendar and rules as amended. Okay, that brings us to item number 5, House Bill 1954 by Chairlady Hilton Haynes. Your motion and a second. You are recognized.
Thank you, Mr. Chairman. Last year, we passed Public Chapter 295, which would allow some mid-level providers to prescribe Schedule 2 or 3 drugs under very limited circumstances. There was a technical error in Section 2B. It read, "is employed by or contracts with a state correctional facility." It should have read, "is employed by or contracts with or subcontracts through the contracted healthcare vendor with the Department of Corrections." We don't contract with a state correctional facility. The contracts are with the Department of Corrections, and this bill makes that technical change.
All right, do we have any questions for the sponsor of the bill? All right, seeing none, will the clerk please open the board? House Bill 1954, all those in favor vote aye, opposed vote no. Will the clerk please take the vote?
Mr. Chairman, you have 20 ayes, 0 nays.
All right, House Bill 1954 passes and moves on to calendar and rules.
Thank you, Mr. Chairman and committee.
Yeah, okay, that brings us to item number 6, which is House Bill 2145. And so I'm going to pass the gavel on to Chairman Leatherwood.
Thank you, Mr. Chairman. This does bring us to item number 6, House Bill 2145. Do I have a motion and a second?
Motion.
Okay, the bill is now properly before us, and Chairman Terry, you're recognized for a description.
Thank you, Chairman and Committee. This is the Respiratory Care Interstate Compact, and as you all may be aware, Tennessee is involved in several healthcare-related interstate compacts, including those for physicians, nurses, and physical therapy. This compact is for respiratory therapists. These compacts help healthcare professionals expedite their credentialing process without sacrificing quality, thus improving Tennessee's access to critical healthcare workforce. By passing this interstate compact for Tennessee, hopefully if we can get this done in time, we will be one of the first 7 states to adopt the compact, which will ensure that Tennessee has a founding seat on the compact's governing commission. Stand ready for questions.
Any questions of the sponsor? Seeing none, I think we are ready to vote without objection. We're voting on House Bill 2145, and if the clerk would open up the vote. And if everybody would cast their vote, anybody want to change their vote? Would clerk please take the vote?
Mr. Chairman, you have 21 ayes, 0 nays.
All right, the ayes have it, and the bill moves on to government ops.
Thank you, Chairman and Committee. All right, that brings us to item number 7, House Bill 2598 by Leader Camper. You are recognized.
Thank you, Mr. Chairman, Committee. Mr. Chairman, Committee, House Bill 2598 deals with certified nurse midwives. In this state, Tennessee has a degree of independent practice that certified nurse midwives have, including supervision, collaboration for services. It's different with the states around us. And so what we're trying to do is help policymakers make informed decisions on policies for certified nurse midwives. And this bill directs the department to study it, to study our neighboring states, to provide a report back to the House and the Senate, and also our legislative librarian. And that report will be prepared and submitted to us December 31st, 2026, and it can be done electronically.
All right, thank you for that explanation. And do we have any questions for the sponsor of the bill? Oh, Chairman Martin, you're recognized.
Thank you, Leader Camper. I just wanted to mention again, using a midwife right now as my wife's about to have a baby in the next couple of weeks. I greatly appreciate what they're doing and thank you for bringing this and bringing light to that profession, especially in rural communities. They provide a great resource for us. So thank you.
Thank you.
Thank you. All right. Seeing no further questions, will the clerk please open the board? All those in favor vote aye, opposed vote no. All right, will the clerk please take the vote?
Mr. Chairman, you have 21 ayes, 0 nays.
All right, House Bill 2598 passes and goes on to calendar and rules.
Thank you, Mr. Chairman, Committee.
Thank you. All right, that brings us to item number 8, House Bill 2029. Leader Faison, you are recognized. You have a motion and a second.
Good afternoon, committee. Certainly good to be with you. Mr. Chair, with your indulgence, we need to take one amendment off.
Which amendment do we want to?
Drafting
put
code
on?
13349. We put it on in subcommittee.
It's not traveling with it. Yeah. Yeah. What do you want on the bill? Because it doesn't technically travel with it.
Okay, then we want 4914 and 5488. Those two, want to put them on the bill.
Okay. Which one do we need to put on first? Do they both?
Yeah, both of them. Just,
Doesn't matter the order?
no, sir.
Okay, let's go and, okay. Drafting code 014914. We have motion and a second. Without objection, we'll vote on amendment 014914. All those in favor say aye. Opposed? Ayes have it. And the next amendment is drafting code 015488. Is that correct? We have a motion and a second. If there's no objection, let's go ahead and add that. All in favor, vote aye. Opposed? Ayes have it. And I make a motion that if this bill passes, we roll those into one amendment. Okay, we are in proper form. You are recognized.
Back on the bill. Thank you, Mr. Chair. Committee, many of y'all know that my very favorite person alive on this planet today is my wife, and she is a registered dietitian. What you need to know is that her profession hasn't changed at all in the code in Tennessee since 1987. Since that time, there have been all sorts of people and new things and new ideas that are in that space, the dietitian space. This bill basically updates the whole code for dietitians and also allows for people who do health and nutrition counseling to be a part of that and have a way to do that legally here in the state of Tennessee without taking away from what registered dietitians do. And that's basically a 15,000-foot view of what this bill does.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, we're going to vote on House Bill 2029. Will the clerk please open up the board? All those in favor vote aye. Opposed vote no. Will the clerk please take the vote?
Mr. Chairman, you have 20 ayes, 0 nays.
All right. House Bill 2029 passes and moves on to government operations as amended. All right. That brings us to item number 9, House Bill 2100.
Thank you, Mr. Chair, committee. Certainly good to be with you again.
Long time no see. You have a motion and a second. You're recognized.
I think I heard somebody say question on the bill. I was pleased.
You are recognized.
Question on the bill. We have a substance in Tennessee called methadone. And there have been various and sundry reports and reviews on the effectiveness of methadone and is it good, is it bad? Last year, I did some deep research into methadone and what I believe it can do. Methadone is legal here and it is used. It's prescribed here on a regular basis. My wife and I went to Portugal, which you need to know has some of the lowest addiction rates in all of America and all of the world. American addiction rate right now is around 15%. In Tennessee, we're around 18%. That's nothing that we can be proud of. Even though methadone is a intoxicant substance, it's a safe gateway out of illegal substances. We currently have a CON on methadone. The governor's original bill for CON that we're not moving now, we're moving Representative Garrett's bill, had this included in to do away with the CON on that. This bill just simply completes what that doesn't do and takes the CON off of methadone. You would still have to have a doctor at your facility, whether it's a 501c3 or health facility, whatever it is, a counseling facility, you'd have to have a doctor there to prescribe it, but you wouldn't have to have a CON, pass a CON to be able to prescribe it anymore.
All right. Thank you for that explanation. Do we have any other questions for the sponsor of the bill? I do want to make a comment and just more of a educational standpoint. What we're seeing from in a hospital setting and from a surgical setting, particularly on like big back type cases, is using IV methadone. And what they're finding out, obviously from a post-op opioid use, you're decreasing the amount that you're having to give post-operatively, short-term and long-term. And so they're obviously, it has a stigma sometimes to it, but it does have medical uses. And so appreciate you bringing the bill. So
Can I add something to that, Mr.
yes, sir.
Chairman?
You're recognized.
I meant to add, and it just slipped my mind. While I was in Portugal, I went several days to a place that they have a methadone clinic. And I sat down and talked to people from white collar professionals all the way to blue collar workers who came every day at lunchtime on their lunch break. They would get off of work and they would go and get a shot of methadone and go back to work. And I asked them, do you feel like this is helping you get away from the illicit substance that you found on the street? And every single person, whether it was a white collar professional or a blue collar worker, they were so thankful that there was some place that they had a need for a fix. They could get a fix, they could get back to work, and they knew it wasn't laced with fentanyl or something that was going to kill them.
All right. Thank you. And Representative Capley, you're recognized.
Thank you, Mr. Chairman. Sponsor, I've seen some language about county mayor, and how would this affect unincorporated communities? Do they have to go before like the county commission, or how does this work?
You're recognized.
Thank you, Mr. Chair. Representative Capley, everything else stays the same. If you have, whatever you have to do currently outside of a CON in Tennessee to be able to use methadone, you just have to use it. You just have to do it.
Okay. Thank you.
Okay. Chairman Kumar.
Thank you, Mr. Chairman. Thank you, Chairman. Now, are you advocating a program here along those lines? Because Oregon tried that and had to go back for a couple years. They would take somebody who has any drugs on them, and they were not arrested, and a person was given a citation to show up at a particular time to court, which of course they never did. And as the word spread that in Oregon, basically use of illicit drugs was legal, it created a lot of influx of people. And subsequently, the certain cities like Portland became really unsafe. I have a friend of mine who practices in that area as a physician, and they were really overwhelmed by it. And ultimately, they've had to withdraw that program. I guess it's a cultural thing. If what you're telling me is that in Portugal, this was working very well.
You're recognized.
Thank you, Mr. Chair. Dr. Kumar, I would say whatever Oregon did, we don't want to do it. They've not done much right recently. This really has nothing to do with what they're doing. I'm not trying to make any illicit drugs legal. What I'm trying to do is for the people who have therapy places that do the counseling, that are doing the work, that have rehab facilities, that if they have a doctor on their team, they can use this at their discretion to help somebody get off of an illicit drug.
You're recognized.
Thank you. Thank you for clarifying. I think that makes sense. Methadone and buprenorphine are the two drugs we have for addiction. Methadone has to be administered with a physician presence, whereas buprenorphine can be given as medication. Thank you for clarifying it, and I hope you enjoyed your travel.
Yes, sir.
Chairman Williams?
Thank you. Thank you, Chairman Faison. I had a year and a half ago, had one of these clinics want to come to the city of Cookeville. The city had a zoning ordinance that limited where, they could go. And they had a very difficult time finding a place to do that. So they went outside the city of Cookeville into Putnam County in order to relocate or to locate this facility where there was no zoning. However, they still, under that premise, had to get a certificate of need to be able to locate that clinic in the county. The only recourse that tens of thousands of my district had in order to do that was to come to the CON board to fight the possibility of that clinic coming into our community. If we repeal CON for this and zoning doesn't apply to it anymore, or a community can't keep one of these clinics away from a school or something like that, what would be the remedy for citizens to try to prevent something like this becoming close to a school if you don't have zoning or anything like that?
You recognize?
Thank you, Mr. Chair. Obviously, this bill, you would still have to follow any local ordinances or zoning, whatever that is, you still have to follow that in your area. This does do away with the CON that you would be able to go to them, which the CON is about to be dissolved anyway. But on a broader thought, Representative Williams, we in society complain often about addiction and people who can't get out of a substance. But I have noticed we often say we want them to get help, but just don't get help here. Go get help someplace else. And we do that all the time. And at some place, we're going to have to look at society and say, we've got to help these people somewhere. And there's that whole thing, not in my backyard. The problem is drugs are in our backyard. And if there's a place that can help and can counsel them and use this correctly, I want us to get help for those people.
You recognize?
Thank you. There's no question that I think that these clinics are beneficial to some, but these are the ones that are also counting pills and taking away and diverting them too. And so sometimes it's not the clinic that's the bad actor. Sometimes it's the patient too. And so where they're located, I think, makes an important determiner on their success, really, not just the patient, but the business's success as well. And to your point about CON, we moved the vast majority to phase out of CON to licensure, but currently there's CON, even with the passage of the bill we talked about, CON still will exist, and it's for this reason, I think. And so, and other areas of healthcare that we have, I think your passion for folks that are addicted to these substances is obviously extremely important. But I feel like that there are some instances, and even in our current language with all the reform, some folks should still remain under this guidance to give citizens an opportunity to say no if they feel like that's what's best for their community. And so I appreciate the effort, but and to answer my question as well. Thank you.
Thank you. Okay. Any further questions for the sponsor of the bill? All right, seeing none, will the clerk please open the board? All those in favor of House Bill 2100, moving on to Finance, Ways, and Means, vote aye. Those opposed, vote no. All right, will the clerk please take the vote?
Mr. Chairman, you have 13 ayes, 6 nays.
All right, House Bill 2100 passes and moves on to Finance, Ways, and Means. right, that brings us to item number 10. House Bill 2459 by Chairman Faison. I've got a motion and a second.
Mr. Chair,
And I
can I
believe-
work with you one more week on this? Can I have a roll 1 week on this? Is that possible?
How about let's roll this to the end of the calendar? Because I don't think we're gonna get through the calendar.
Sounds like a plan to me.
Without
Thank
objection,
you. Thank you,
House
committee.
Bill 10 will roll to the heel of the calendar. That brings us to item number 11. So let me get myself in order here. Okay, that's House Bill 2358 by Chairman Hawk. You are recognized. And I believe there's an amendment.
Thank you, Mr. Chairman and members. The amendment we'd like to introduce is 014994.
Okay. You have a motion, a second on amendment 014994. So without objection, we'll be voting on that. All those in favor say aye. Aye. Opposed? Ayes have it. We are on the bill as amended. You are recognized.
Thank you, Chairman and members. I was hoping I had a bill this year where I could use the words tibia tuberosity. That was, I've never heard that before. Chairman Martin, thank you very much for that. House Bill 2358 is dealing in the TANF space. I've been working along with you, Chairman Terry, in this space for several years now. And today's bill is going to allow us to use unobligated federal TANF funds to clear some of the child wait list to ensure that eligible working families can participate in the Smart Steps program. This has been a collaborative effort. It's very much a work in progress, but I feel we've got this bill with this amendment in a posture that can work for all considered, Chairman and members.
Okay. All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, we're going to be voting on House Bill 2358 as amended. Will the clerk please open the board? All those in favor vote aye. Those opposed vote no. All right. Will the clerk please take the vote?
Mr. Chairman, you have 20 ayes, 0 nays.
All right. House Bill 2358 passes and moves on to government operations as amended.
Thank you, Chairman and members.
All right, thank you. And that brings us to item number 12, which is House Bill 2313. And Chairman Hawk, you are recognized. Do we have an amendment?
I do not believe we have an amendment on this one, sir.
Okay. Do we have to? Okay, you're recognized.
Thank you, Mr. Chairman, members. House Bill 2313 authorizes the Department of Health to establish a voluntary, I'll reiterate, voluntary permissive evidence-based home visiting program focused on early childhood mental health. This is something that we're using a model of a nurse family program that we started almost 20 years ago now. So it models itself after that. Once again, it is strictly permissive and a voluntary program. Mr. Chairman and members, happy to stand for any questions.
All right, thank you. I think we have some folks here that would like to testify. So without objection, we will go out of session. I believe I have, is there a Brittany Ruiz? And then. Okay, you have 3 minutes. Tell us your name into the microphone and who you're with, and then you'll have 3 minutes.
Thank you. Hi, Chair and members of the House Health Committee. My name is Brittany Ruiz, and I am a longtime citizen lobbyist with a keen eye with regard to low-income vulnerable populations. I've been in this work for over a decade, and I am right now volunteering and representing Citizens Commission on Human Rights Tennessee, and we oppose this bill as written. Specifically, I want to go over the baseline statistics of Tennessee's diagnosis rates and psychotropic drug consumption. Right now, 1 in 3 parents have reported, per a Vanderbilt Health survey last year, 1 in 3 parents reported that their child has a mental health diagnosis. 11,453 newborns and toddlers on psychotropic drugs. 1 in 12 school-age children in Tennessee on psychotropic drugs. 1 in 3 foster children, this figure is 9 years old, are on psychotropic drugs. An estimated $500 million was spent between year 2024 and 2025 on psychotropic drugs in the state of Tennessee. The bill's own language says that this program must include parent-child psychotherapy. Unfortunately, for those families, they are not informed that this is a mandatory reporter coming into the home. An amendment should be required that puts that in place. Separately, this program mandates that it has to include developmental and mental health assessments. Again, I point you to the fact that 1 in 3 parents have already stated that their child has been diagnosed with a mental health condition in the state of Tennessee. Separately, for this to work, you have to actually diagnose a child per ICD-10 codes. That diagnosis, more often than not, specifically in the state of Tennessee, ends up in that child being on psychotropic drugs. Separately, there's no statutory language that allows that parent to opt out once they've opted into the program. I personally have stepped in for low-income minority families who didn't have a voice when they opted out of a medical procedure inside their home and had DCS called on them. There has to be statutory opt-out provisions for low-income minority families. Separately, the last thing is that there's no tracking on what are the metrics and outcomes for this particular program. If we are not intending on drugging or diagnosing children, then we should be following those metrics. And also following whether we're doing DCS referrals from this. Thank you so much for your time, and I'm here if you have any questions.
All right. Thank you for your testimony. And do we have questions while we are out of session? All right, seeing none, thank you for your testimony. Okay, all right, without objection, we will go back into session. Chairman Hawk, you are recognized.
And thank you. Just to reiterate what I've said in my opening comments, this is to establish and administer a voluntary early childhood mental health home visiting program. I don't know where that other information came from, but this is strictly voluntary, Chairman and members.
All right, thank you. Do we have any questions for the sponsor of the bill? Chairman Leatherwood, you're recognized.
Thank you, Mr. Chairman. I do have concern with the bill and the potential program. So often I think when we establish these programs, even though they're very well-intentioned to try and help people that need the help, quite often we inadvertently or with some purposefully end up promoting problems. The funding will follow the problems. No problems, no funding. More funding, you need more problems. And so I am concerned about that aspect of it. Any
You're recognized.
response to that?
Thank you.
Oh, no further questions? All right, no further questions for the sponsor of the bill. We're going to be voting on House Bill 2313 by Chairman Hawk. Will the clerk please open up the board? All those in favor vote aye, opposed vote no. All right, will the clerk please take the vote?
Mr. Chairman, you have 10 ayes, 3 nays, 5 present not voting.
All right, House Bill 2313 passes and moves on to government operations.
Thank you, Chairman and members.
All right, that brings us to, let's see, item number 13, 2351 by Chairlady Littleton. you are recognized. Okay.
Thank you, Mr. Chairman.
Can I get a motion? You have a motion and a second?
House Bill 2351 sets a path for nursing students to become CMAs based upon passing specific nursing classes with an appropriate grade. Allows 90 days to complete the program. It is currently 30, and authorizes the Board of Nursing to adopt a program for out-of-state programs and makes minor adjustments to help keep programs available.
All right, thank you. Do we have any questions for the sponsor of the bill? We have someone here that would like to speak in support, if that's, okay. All right, without objection, we'll go out of session. Rena Reddish. Do not see her here. Okay, without objection, we'll go back into session. Okay, no further questions for the sponsor of the bill. All right, let's go ahead and vote. Will clerk please open the vote? House Bill 2351. All those in favor vote aye, opposed vote no. Clerk, please take the vote.
Mr. Chairman, you have 18 ayes, 0 nays.
House Bill 2351 passes and moves on to government operations.
Thank you, Mr. Chairman and committee.
That brings us to item number 14, House Bill 1784. Chairman Bolso, you have a motion and a second.
Mr. Chairman, good afternoon, members of the committee. This bill seeks to designate January 22 on our state calendar as Sanctity of Life Day. All of you will immediately recognize that as the date in 1973 when the Supreme Court decided the case of Roe versus Wade. Earlier, on January 13 of 1984, President Ronald Reagan issued a proclamation 5147 that designated January 22 on our national calendar as Sanctity of Human Life Day, but we have not yet done that in our state blue book. This bill will designate January 22 as Sanctity of Life Day. And with that, Mr. Chairman, I'm happy to answer any questions.
Okay. All right. Representative McKenzie, you're recognized.
Thank you, Mr. Chair. Just curious with all the things that's before us and the fact that this should be water way over the dam and down the river and to the next county, to the next state, bringing to the Gulf of Mexico. Why are we continually, this is probably the 5th, 6th, 7th, 8th piece of legislation on this. While this is fairly innocuous, is this, my question to you, is this an attempt to gloat, or is this just a never-ending thing that we're going to have to re-litigate, re-argue every single year?
Chairman Bolso, you're recognized.
Thank you, Mr. Chairman. Representative McKenzie, I can say this, that the fight for life goes on. Obviously, Dobbs overturned Roe versus Wade on June the 24th of 2022. But as you know, there continue to be more than 1 million abortions a year just in the United States. So this is something certainly that is timely because we continue to fight to protect unborn, innocent human life in this state every day. So I would not consider this as water that's gone down the Gulf of America. This is an active, live issue that we need to be debating here today.
All right. Thank you. Representative McKenzie, you're recognized.
Thank you. Thank you, Mr. Chair. It harkens me back to that picture of the Gulf oversized. I guess I would kind of see that maybe with one eye squenched. If we cared about life in this chamber as much as we care about these types of things, once that baby comes out, if it doesn't meet a certain threshold, we just seem not to care about that baby anymore. And that baby born in that situation that might end up incarcerated, we really don't care about him then or her then. Life is life. And if that was truly how these pieces of legislation were crafted, all life is sacred and valuable and inviolable, and we need to cherish that, I'd be fine with these. But that's not what you're saying. I see no pieces of legislation that values life of an inmate. I see no pieces of legislation that values the life of a crack-addicted baby.
Can you stay on the bill, please?
Thank you, Mr. Chair. So, thank you, Mr. Chair.
Thank you. You recognize? You're good. All right. All right. Representative Brooks, you recognize.
Representative Bozo, I really don't see the purpose for this bill. I think this bill is going to be re-traumatizing for mothers who wanted those babies but didn't have a choice. I don't know. I don't see any bills about victims of gun violence, children that are losing their lives. I don't know, this really, I don't know, I'm disturbed. It's disturbing to me.
Chairman Bosso.
Thank you, Chairman Terry. I can only say, Representative Brooks, that the fact that there are some elected officials in this body who really do not consider the ongoing slaughter of innocent unborn human life in this state an important public policy issue demonstrates the need that we focus our state and its people on the fact that every life is valuable, is unique, is sacred, and having a day set aside to recognize the sanctity of the life of the unborn is exactly what we need in Tennessee at this point.
Representative Brooks.
I would say the same for children that lost their lives to gun violence.
All right. Thank you. Chairman Hill.
Thank you, Mr. Chairman. The bottom line, why this piece of legislation is necessary, same reason why we put monuments all over the Capitol grounds, the same reason why we pause and consider what is important in a statement made by this legislature matters. And if there are members that are in this body that are unhappy with this, I'm sure that there'll be a no vote. If you've got a great idea to bring a bill because you want to honor someone or bring a certain day, feel free, get the votes to pass it. But the bottom line is, sponsor, thank you for bringing this because life matters. We know that life is important. We know that the fight that is in this chamber or in this body and in the chamber on the floor day in and day out, it is a consistent and constant struggle between good and evil. And so I'm grateful that you're willing to put the stake in the sand, the stake in the ground, and say, here is a day that we are going to honor the sanctity of life. And so everybody knows it. And so I would encourage a yes vote, but if you can't vote for it, that's your prerogative. But demeaning this piece of legislation and demeaning the day is not appropriate, and I look forward to supporting it. So thank you, sponsor.
All right, thank you. All right, seeing no further questions, will the clerk please open the board for the vote? All those in favor vote aye, opposed vote no. All right, will the clerk please take the vote?
Mr. Chairman, you have 14 ayes, 5 nays.
House Bill 1784 passes and moves on to count and rules.
Thank you, Mr. Chairman. Thank you, committee.
Thank you. That brings us to item number 15, House Bill 2092. You are recognized, and do we have?
Thank you,
No
Mr.
amendments.
Chairman, committee. House Bill 2092 requires the Department of Health to create an outreach program of CMT in the state. Charcot-Marie-Tooth disease, CMT, is a group of inherited conditions generally passed down through families that cause peripheral nerve damage. It's estimated that 1 in 2,500 now have CMT, including celebrities like Alan Jackson and myself. Nobody got that. We were actually both diagnosed in 2011. We really have no way of knowing how many Tennesseans are afflicted with because no data has ever been collected. House Bill 2092 requires the department to establish and provide a toll-free or web-based hotline for a person to report their diagnosis or to donate to the research of CMT. This is a one-year, non-recurring program. And with that, Mr. Chairman, I renew my motion. Take any questions.
All right, do we have any questions for the sponsor of the bill? All right, seeing none, will the clerk please open the board to vote on House Bill 2092? All those in favor vote aye, opposed vote no. All right, will the clerk please take the vote?
Mr. Chairman, you have 19 ayes, 0 nays.
All right, House Bill 2092 passes and moves on to Finance, Ways and Means.
Thank you, Mr. Chairman, committee.
Okay. House, item number 16, House Bill 1040 has been, we're going to roll that to the hill. That brings us to item number 17, House Bill 1694. You have a motion and a second. And let's see. We do have an amendment. Let me get myself in order here. Okay, do you have drafting code 014137?
That's correct, Mr. Chairman.
Okay. You have a motion and a second, so without objection, we will vote on that. All those in favor vote aye. Aye. Opposed? Ayes have it. We are back on the bills amended. You're recognized.
Thank you, Mr. Chairman. Committee, this legislation simply allows emergency medical personnel to stabilize and transport an injured canine officer if no human patient requires care at that time. Human care does remain a priority. As you know, across our state, canine officers serve on the front lines. They detect explosives, track suspects, locate missing children, and protect our officers. These dogs are not pets, but are trained public safety assets who enter the most dangerous situations before our human officers do. This legislation clearly defines who a canine first responder is and specifies the limited care to emergency stabilization. It provides good faith civil and criminal immunity so EMS personnel can act without fear of disciplinary action. And this is not an expansion of veterinary service. EMS may simply provide the emergency care to transport, and they cannot provide surgery or act as veterinarians. So with that, I ask for your support, but stand ready for questions.
All right, do we have any questions for the sponsor of the bill? All right, seeing none, we are going to be voting on House Bill 1694 as amended. Will the clerk please open up the board? All those in favor vote aye, opposed vote no. Clerk, please take the vote.
Mr. Chairman, you have 20 ayes, 0 nays.
All right, House Bill 1694 passes as amended and moves on to government operations.
Thank you, Chairman and Committee.
All right, thank you. And I'm going to take a pause there for a second. We're going to take up item number 30, House Bill 1807. You have a motion and a second.
Thank you, Mr. Chair, and thank you, committee. What this bill does is, this bill, it clarifies that a surviving parent is always considered next of kin for purposes of suicide-related autopsy determinations and appeals. And why this bill was introduced is because there was a case where a pair of parents wanted an autopsy conducted on their daughter, but the daughter's spouse did not. And because the person with the highest statutory priority had standing, which was the spouse's wishes were the only ones that were considered. And the parents were unable to request or review or participate meaningfully in the process. And Mr. Chairman, I think we've got someone here that wants to speak on it. Is it okay if we go out of session?
Yes, let's see, let me get the name here. Okay, Jamie Dickerson,
Yeah.
I believe.
There she
Okay,
is.
without objection, we're out of session. Okay, and for the record, state your name, who you're with, and then you'll have 3 minutes.
All right, thank you, Mr. Chairman. My name is Jamie Dickerson. Some of you heard me speak last week and some of you have not. I am the parent that has addressed coming up with this bill. The reason being is that my daughter was murdered 2 years ago in July of 2023. My daughter was found with a bag over her head, tape around her neck, deceased in the shower. She had asked for a divorce 2 weeks prior. Her husband was at the house at the time. My grandson was there. My son-in-law went and ate lunch in another room for 30 minutes and let my daughter die. He then sent my 7-year-old grandson in to find his mother deceased and then called 911. After my daughter passed away, I found out that that there was no way for me to fight for her rights. I knew something was wrong and he claimed it was suicide all along. He had told everybody that she committed suicide, including my grandchildren, including my 7-year-old grandson who had to testify, who had to have 3 forensic interviews and was never believed that his parents were fighting because his dad said that his mother committed suicide. After her investigation was poorly done, the detectives had declared that she had committed suicide. They saw no foul play intended. So I got back her autopsy, and her autopsy was stating that this is what the investigators had said. And I said, no, this isn't right. Something is wrong. And I know something is wrong. And so I immediately found out what I could do next as a mother. And I submitted this request for reconsideration of suicide as the manner of death. And I was immediately rejected. I was told, you're her mother and only her spouse can turn this form in. And this form was given back to me. I called, I spoke to the medical examiner myself. They kept rejecting me. I had nowhere to go with that. It took me 10 months to get a confession from my son-in-law that he killed my daughter. My 7-year-old grandson was left in his care for 10 months in the hands of a murderer because I could not get anybody to investigate my daughter's case. And as a mom, I was not going to give up. And so I did continue to fight. And now that he is behind bars, I now fight for other families so that somehow my pain can be turned into purpose, and other parents, if this is their case, that they're able to turn this form in and have this reconsidered, because my daughter did have bruises on her neck, her thighs, her wrists, her ankles. I sat with her in the hospital and saw and witnessed all of this, which were later on found on her medical reports, but were not in any of these other documents. But if they would have reconsidered this, they could have seen some of these findings and been able to see some of the details that were later on found in the case. So that is why I'm asking that this bill be passed, and so that other parents don't have to suffer as myself and my husband have, and just trying to fight for justice. And we do have our grandson and our granddaughter now in our care, and we will raise them until they're 18. And they will know that their mother did not commit suicide and she did not choose to leave them. And so that's why the fight was completely worth it. Thank you for listening to me.
Thank you for your testimony, and you obviously came in our subcommittee, and as I said in subcommittee, a lot of bills, a third of the bills that we do up here are cleanup bills, and a lot of the other bills are because things haven't been done correctly. And it's unfortunate that sometimes, constituents bring us situations to right wrongs that we as government mess up. So it is, yeah, I've signed on to this bill because, I mean, we have to fix this. So, but I thank you. Do any other members have any comments while we're out of session? Chairman White.
Thank you, Chairman. I just want to congratulate the sponsor. You've had two excellent bills. That one on the floor last night was really amazing. Thank you. And then this one. Thanks for bringing these to us. I appreciate this. Thank you.
Any further questions while we're out of session? All right, seeing none, thank you for your testimony. Without objection, we'll go back into session. You are recognized.
Move. I'm here for your consideration.
Okay, all right. Question's been called, so will the clerk please open the board for the vote? All those in favor vote aye, opposed vote no. All right, clerk, please take the vote.
Mr. Chairman, you have 20 ayes, 0 nays.
All right, with House Bill 1807 passes and moves on to calendar and rules.
Thank you, Mr. Chair, and thank you, committee. Thank you so much.
Thank you. And I'm going to, without objection, go back out of order. Senate Joint Resolution, item number 21, Senate Joint Resolution 0565. Representative Alexander. You have a motion, a second?
Thank you, Chairman, and thank you, committee. This is a Senate joint resolution to recognize March 2026 as Endometriosis Awareness Month. This is really a follow-up to what Governor Haslam had done in a proclamation in 2018. 1 out of 10 women are affected by endometriosis. I sat Saturday night by a dear friend who told me that their daughter had miscarried 3 times and recently had surgery for endometriosis because that was why she was miscarrying. It affects women in multiple different ways, and we just wanted to do this Senate joint resolution to establish the importance of making people aware of endometriosis and all the illnesses it causes.
All right. Do we have any questions for the sponsor of the resolution? All right. Seeing none, will the clerk please open up the vote? All those in favor vote aye, opposed vote no. Will the clerk please take the vote?
Mr. Chairman, you have 19 ayes, 0 nays.
All right. We have Senate Joint Resolution 565 passes and moves on to calendar and rules.
Thank you, Chairman. Thank you, committee.
All right, thank you. That brings us back to item number 18. And I'm going to, without objection, House Bill 2136 roll to the heel. That brings us to item number 19, House Bill 2075, and I'm going to pass the gavel.
Okay, thank you, Mr. Chairman. And this does bring us to item number 19, House Bill 2075. Do I have a motion? Second? Have a motion and a second. Also, as a reminder, we did hear this bill last week. There are a couple of amendments that we put on last week. Are there 2?
That's the 2 that have been rolled into one.
We'll just make a motion to roll them into one.
And those 2 amendments have already been rolled into one amendment, and that's on the bill.
We have to make a motion to roll them into one.
So that,
To roll those two amendments into one.
okay, so make a motion that staff will roll those two bills, two amendments into one amendment. And I think that puts us in the proper position. And Chairman, you're recognized on your bill.
All right. Thank you, and I apologize for all the confusion. We had some folks that came and testified last week, and so this is the Helping Open Pathways to Effective Treatment Act, and it creates structured medically supervised pathway for Tennessee institutions to participate in FDA-authorized clinical trials studying ibogaine for opioid use disorder, PTSD, traumatic brain injury, and other indications approved under an FDA investigational new drug authorization. And so what this bill does, it establishes a state council to oversee participation in legitimate FDA-regulated clinical trials and allows qualified Tennessee academic medical centers and research hospitals to join a multi-state consortium conducting the drug development trials, and it creates strong safety requirements, including physician supervision, hospital-based administration, cardiac screening protocols, and compliance with an FDA investigational new drug authorization. And so we have the folks they're here if we need to go out of session to have them testify or answer questions on the bill.
Okay, any questions of the sponsor? Representative Hill, you are recognized.
Thank you, Chairman. And we may need to go out of session just because I have serious concerns with the legislation, not from the perspective of the research or the drug or the potential drug or anything like that. But I'm just concerned as I look through the legislation that we're creating a state-sponsored biotech. And we're doing it in a fashion that we don't do with anything else. We don't do it that I'm aware of with any other drug or potential drug that's out there. And it gives me pause for concern because I don't know who owns the drug once it's done. I don't know who benefits from it. We are doing this in the name of helping veterans. I believe that's what was said to me and the folks that came to visit me, which is fine. I'm not against the research that's being done, but this is something that appears to be being done in a way that I don't know that is precedented in the way that we handle ourselves. And so I guess my question either to the sponsor or if we need to go out of session is who owns the intellectual property that the request is being made that the state makes a $5 million investment in conjunction with other states? Who owns it? Who benefits? Who manufactures it? Who is going to dispense it? And who's in control of it? And I guess that's my question, or series of questions, if you will, Mr. Chairman.
Okay, without objection, we will go out of session. And Ricky Harris, William Dennis, Alex West, any or all three of you can come up. And if each of you, when you get the opportunity, identify who you are and who you're with, and then whoever wants to, if you would like to address Representative Hill's question, feel free. Who's going to be the brave one first?
Yes, Chairman. My name is Alex West, and I'm a retired, 20-year retired Navy SEAL with 15 combat deployments. I'm also a associate mental health therapist based here in Nashville. Representative Hill, regarding the, thank you for the questions. Those are very great questions, by the way. Within it, you will see that the state actually will get a portion of the money that is made. So the investment that is made, the $5 million investment, will be made, our hope, will come back to the state where it could actually have the potential to profit the state within that investment. But I'll pause right now. I don't know, Ricky, if you have anything more. Oh, yes. Would you like, Chairman, would you like me to give the testimony I gave last week or what?
Answer the question.
I think we'll just go with questions this week. And let me take this moment, though. I think I did apologize last week. I'll apologize again we had a hard stop. I felt a little rude at least, but when we've got the hard stops, I have to take a hard stop. So I apologize again for cutting you off last week. But yeah, we'll just go into, if anyone else wants to respond to that question, you would like to? Thank you.
Yes. Hi, I'm Ricky Harris. I'm the CEO of Tennessee Voices. A little further explanation there. In the bill, we did identify that 2% of the revenue on the IP would come back to the state. And our hope was that with this revenue, that we could reinvest in continued opportunities to support mental health in the state of Tennessee.
Chairman Hill, you're recognized.
Thank you, Mr. Chairman. And so the owner, if you will, is Tennessee Voices. And I'm sorry, I'm kind of looking around here, but the owner is Tennessee Voices of the overall IP.
No, actually, Tennessee Voices doesn't stand to benefit at all from this. We're acting as advocates that our state be involved in multi-state consortium with Texas to study the opportunity to have a breakthrough treatment for opioid addiction and other mental health needs.
So again, the question is it owned by the states? It's owned by the states that are coming together and putting the money together. I mean, this is a capital raise. That's what this is, correct? I mean, and I'm not trying to be aggressive. It's just, this is the equivalent to a state-sponsored capital raise to do FDA trials. Is that correct?
That's beyond my expertise, but I'll say what I understand, and that is that in the Texas model, the drug developer that's working with them, that will be selected to work with them, has to match the funding that the state provides to be part of this, if that helps answer any of your concern.
Chairman Hill, you're recognized.
Thank you, Mr. Chairman. And I certainly don't intend to monopolize the committee's time. I guess I'm still trying to understand our participation in we're becoming business partners with whom as a state? And that's what my question is. We're becoming business partners with other states, or are we becoming business partners with an unnamed entity or a commercial company? That's what I'm asking.
You're recognized.
As I understand the bill, we would be participating. We're putting together a council to select a research institution to participate in FDA clinical trials and learn what we can learn to solve our mental health crisis.
Thank you. And thank you, Mr. Chairman. Who takes it from there? Because again, if we're funding with other states, we're funding the research and everything goes great and it's 5 years out or a decade out. And again, my concern is not the drug itself or the research itself. It's what happens next. So is there commercialization that takes place? Because 2% of the revenue is going to come back to the state of Tennessee for our $5 million investment. From whom? Right? And who is the one that is manufacturing and responsible for the distribution, not just of our wonderful potential profits, but of the drug? And that's my question.
As I understand, those decisions would be made by the council that's formed in the bill.
Okay, Mr. Chairman, I'd like to speak on the bill after we come back in session.
All right, thank you. Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. And my concern, I'm glad my colleague has brought up these questions, because my concern when folks came into my office talking about this bill, we talked about research institutions in the state of Tennessee. And I'm all for that. But this sounds like has the potential of us sending $5 million to Rice, Baylor, Texas A&M, or some other state. And we've got great research institutions in the state of Tennessee, I think could well do this. But this sounds like the potential of us funding another state's research, which I kind of got a problem with. Thanks.
Thank you. Representative Kaplan.
Thank you, Mr. Chairman. And any one of y'all want to take a stab at this? We keep talking about Texas. The other places this has been done, has it been profitable? Do we have any kind of numbers or anything on that? Or?
So this has not been done currently in any states that I'm aware of, but states that are currently participating in the same process to get a bill to participate in the multi-state consortium include Kentucky, Mississippi, and a number, Georgia, Florida, a number of states who are working on the same bill.
Follow up.
So I guess my question is why the state money portion aspect? Why wouldn't we just legalize the research and let one of the big boys pick up the bill?
Recognized.
I mean,
The bill specifically does not have funding attached to it. So the bill is to allow the state to participate in the clinical trials.
Follow up.
I might have one on the bill. Thank you.
All right. Thank you. Any other questions of our guests? Oh, Representative Hemmer.
Thank you, Mr. Chair. Just a question of clarification. My understanding from talking to individuals earlier was the individuals within Tennessee will be getting, be part of this clinical trial. So can you talk more about, if I understood that correctly, and then where that research will actually be held?
You're recognized.
Hi, I'm Dr. William Dennis. I'm a veteran of the U.S. Navy. I'm an emergency medicine physician and addiction specialist.
Hold on just a second.
They've got to turn it on back on.
Just point your mic at him and let him.
Can you point your mic
You might wanna
towards
use the
him?
middle one.
He's saying,
Yeah. Thank
we
you.
Hi there, I'm
can't,
Dr.
we can't
William.
get yours turned on.
I'm Dr. William Dennis. I'm an emergency physician and a Navy veteran and
Sorry.
an emergency physician and Navy veteran. I'm also an addiction medicine specialist. And basically how this would work is we would, if we worked in consortium with Texas or whichever state comes up with this, we'd want to do it so we could partner with a university or medical center here so we could get Tennessee people involved in this. So people who would benefit for those with mental health addiction or opioid addiction, it would benefit. We would hopefully be able to get it so we could get Tennessee residents involved in this and get them the treatment and help that they need. Thank you.
Sure. Okay. Any other questions to our guests? Seeing none, thank you all very much for your testimony again. And without objection, we will go back into session. Thank you. Now, do you want me to go? You want to speak? No, okay. At the request of the sponsor, we are going to roll this bill to the hill. Thank you.
All right, without objection, we're going to take up item number 25, House Bill 1952. Chairman Williams, you are recognized. You have motion and second.
Members, I have amendment drafting code 014026 we put on in subcommittee, I think.
Okay, you have a motion and a second. All in favor of drafting code 014026?
That is correct.
Okay, vote aye. Aye. Opposed? Ayes have it. And we have another amendment.
I'm not going to move that amendment, Chairman.
All right. You are recognized.
Thank you. Members, House Bill 1952 will help improve healthcare access, strengthen rural healthcare, and reflect the modern training of Tennessee's optometric physicians. In addition, approximately by 2023, 1 in 5 Tennesseans will be older than 65. Rates of cataracts and glaucoma and macular degeneration are increasing annually a little over 2.5%. These population trends, 57 Tennessee counties currently have no ophthalmologist, and optometrists are usually the only persons providing eye care in those counties. This bill authorizes doctors of optometry to perform 3 safe, non-invasive, office-based laser procedures. You can see those in the bill because I failed Latin. So you can see those in there. And in order to be expedient, these procedures are performed safely by optometrists in 14 other states with the complication rate below 1,000th of 1%. As we began the year talking about the rural health innovation that's going to change healthcare, this is a bill that I believe will do that for the better. I believe it's transformative. Currently, students that are based here in Tennessee, that call Tennessee home, will go to a school of optometry to learn not only how to practice optometry, but they also learn these 3 procedures. However, in Tennessee, they can be trained here and they can reside here, but if they want to practice in their full scope of practice, they have to go to 16 other states to do it. This bill would allow them to practice in their full scope of training and encourage those citizens to stay at home here in Tennessee and practice optometry instead of going to those other states. With that, Chairman and members, I'm happy to answer any questions the members might have.
All right, there were some folks that, do you have folks you want to testify? Or
I think we're good, Chairman.
Clemens, you recognize. Representative Clemens.
Thank you, Mr. Chairman. And one of the valid arguments in support of this is the lack of ophthalmologists across the state of Tennessee. And I know it's been argued that this has been done in other states, but Chairman Williams, I was curious, do we have any data from other states that they reduced lack of access to care in rural areas in those other states where this is passed? Do you have any data on that?
You recognize.
Thank you. Chairman Clemens, I don't have any data as it relates to their improvement of access. Oh, the only data that we have is the data from graduates of the School of Optometry who choose to practice outside of the state and the lack of optometrists coverage across those 57 counties where ophthalmologists don't currently exist.
You recognize.
And the other concern I had was, I know that a lot of talk had been about lasers, use of lasers on the eye, but do any of these procedures, and I don't know this, involve using a needle on the eye in any way?
You're recognized.
Currently, hold on, let me make sure. We had so many different versions of this.
Yeah, that's what I was having.
Yeah. No, sir, I don't think.
Paracentesis?
Hold on. Yes, it does. On page 4 of the amendment, section B, it does reference paracentesis in there. It does, yeah. So the answer to your question is yes.
Okay, thank you. I just needed clarification. Thank you, Mr. Chairman.
Chairman Farmer, you recognize.
I move previous question.
All right, question has been called. Will the clerk please open the board? All those in favor vote aye. Those opposed vote no. The clerk, please take the vote.
Mr. Chairman, you have 16 ayes, 3 nays.
Thank you, Chairman and members.
House Bill 1952 passes and moves on to calendar and rules as amended. Seeing no further business at this, or that we can get to at this time, all bills that are remaining on the calendar will be taken up and rolled to next week. We are adjourned.